Hello everyone, I'm Simone. Welcome to Mama Says. Today we're talking to Dr. Saloni Pahwa. She is a renowned pediatrician and I absolutely enjoy my talks with her. She makes so much sense, she busts so many myths, and so I'm super excited to have her on this show with us today. So without further ado, let's get to the show. Okay, so how we're going to do this is I'm going to ask Dr. Saloni Pahwa a lot of questions and she's going to answer them and you're going to listen. Unfortunately, due to lockdown, I can't have her here with me, but we're still going to help you with busting all those myths.
Hi guys, I'm Dr. Saloni Pahwa and today I'm going to be answering a bunch of questions from Mama Says. A little bit about me. I'm a consulting practicing pediatrician. I practice in Bandra, Mumbai. I have over 5 years of clinical experience in the field of pediatrics. I'm a gold medalist in my field from Wadia Children's Hospital in Bombay. I also have clinical experience in pediatrics from NYPH Cornell and Johns Hopkins University Bloomberg Children's School of Health.
So before we get to the myth busting, let's ask her a couple of questions. Doctor, thank you for joining us. I'm so happy that you're here and that everyone's going to listen to all the amazing advice that you have for us. Okay, let's begin. How much do you feed a newborn?
Now, this is a very important question because often we feel like, a baby should be fed as per quantity or as per time. But the golden rule of feeding a newborn is to feed on demand and to allow the child to decide the quantity and the time of the feed. So the way to assess if a child is well fed is to see the resting period and the gap between feeds. So if a child is well fed, they will sleep comfortably or play comfortably between feeds and they'll give you a sufficient gap, which would be roughly around 2 hours plus.
Okay, that makes a lot of sense. Okay, next question, Doc. How important is vitamin D for a baby and how much should a baby be consuming?
Now, vitamin D and iron are the two most important nutrients to supplement in the first year of life. The reason being that a child under 1 year of age gets everything they need from the mother's milk except iron and vitamin D. Also, with the kind of lifestyles that we don't have a lot of sun exposure, neither does the baby. So they tend to be deficient in vitamin D. It's a very important vitamin for growth of bones, development of brain, skull bones, proper development of joints, etc. So very, very important to supplement from day one. Iron is usually supplemented between 4 to 6 months of age, depending on various factors related to the pregnancy and the delivery. So vitamin D important. Vitamin D must be given for the first year of life, must be started from the beginning. Everything else should come from the mother's milk.
Right. Okay, thank you. So we all worry about we read oh my God, newborns are sleep trained. Are you sleep training your baby? There's so much pressure. Should you wake the baby up when you want the baby to wake up, or should you let the baby kind of create its own routine? So yeah, the question is, do newborns have a sleep pattern?
Newborns do not necessarily have a fixed sleep pattern. When I say that, I mean that every child is different and every child can have a different sleep pattern. But in general, early on in life, that is within the first 4 weeks of life, newborns would usually sleep a lot. That would be anywhere between 12 to 18 hours. As they grow older, the waking hours and the activity hours would increase. Also, sleep pattern would change more and more closer to an adult sleep pattern. They would probably nap during the daytime and have longer bouts of sleep in the night. So this is a transition, and this transition, the timeline of this transition can be different for every child. So in terms of the number of hours on an average that children sleep as per age, yes, it goes from more to less. But in terms of a sleep pattern, it is individual for every child.
Okay, Doc, this is a question that so many moms are going to want to hear. The question is breastfeeding versus formula milk and the right age to wean the baby.
Now, one of my favorite questions. I am a breastfeeding prone pediatrician. The reason being that breast milk is gold. It is the best thing that you can offer to your child, and it literally is, like they describe in books, mother's gift to the baby. Now, having said this, as pediatricians, we do understand that often mothers are in a situation where they are unable to feed, which could be because of various circumstances. So when it comes to this debate between breast milk and formula milk, there seem to be these two separate groups that are always at butt heads with each other. But a simple answer to this question is breast milk is your first preference. If you're able to give breast milk to your child, nothing like it. Formula milk is your first preference in a situation where breast milk is not available. So for a mother who's not lactating enough, or for a mother who's not able to feed enough breast milk, your next best choice, rather than letting the baby go hungry or use diluted cow's milk, is formula milk. So it depends on the situation mainly. But here I'd like to put in a request to all new moms. It's nice to be motivated from the beginning and have like a good support system, because it can be taxing early on. But try and breastfeed your babies as much as you possibly can, because it does go a long, long way.
Okay, now let's bust some myths. Doctor, we hear this all the time. Teething causes fever. Yes or no?
Very, very common question. We get this all the time, and this definitely is a myth. Teething per se does not cause fever. The pain and swelling related to teething can cause a mild temperature elevation in the baby. So not all fevers are teething related, or not all teething causes fever. Also, a teething fever would be a diagnosis of exclusion. So if your child is spiking a temperature, please talk to your pediatrician.
Thank you for that insight. We needed it. Okay, another myth that we want to bust, and I'm actually really, really inquisitive to know this one, is does sugar consumption cause hyperactivity?
Natural sugar consumption does not cause hyperactivity. Processed sugar consumption can cause hyperactivity.
Okay, that makes sense. Well, I guess we learn something new every day. Okay, next question. Does cereal help babies sleep longer?
No, that's not necessarily true. A well-fed baby would sleep as long.
Okay, Doc, what is your take on baby walkers? Because we're all told that, there's a couple of countries that have banned the use of baby walkers. There's a lot of people that tell us that the child gets kind of bow legs. So what's your take on baby walkers?
Now, again, a very important question. So, often we get questions about when to introduce a mobile walker, or will a mobile walker help the baby start walking sooner? Again, as a golden rule, remember, when it comes to developing milestones, our job as parents, caretakers, pediatricians is to supplement those milestones. So a walker should come in when a baby is able to start cruising, which is usually between 9 to 10 months of age. By cruising, I mean they hold themselves up and they take the support of furniture around them and they walk along. And then the walker just becomes a safe space. A mobile walker becomes a safe space, where they can support and walk, because they've already learned to do that themselves. But a mobile walker per se will not teach your baby to walk.
Okay, that's interesting. That's good to know. Thank you. Thank you for that. Do kids need the flu vaccine?
Very, very important question. So, the flu vaccine is important for children who are high risk. When I say high risk category, it means a child who has been in the NICU, a child who's had a pneumonia, a child who has any respiratory, cardiac issues, etc. This is a category of children who fall into high risk. For older kids or children who are not high risk, whether they need a flu vaccine or not would depend on their history, how often they fall sick, how often they get cold coughs. So talk to your pediatrician about that. Pertaining to the current times of this pandemic, the flu vaccine is a great idea. So please go out there and get it, because it's extra protection and it works really well.
Great. That was really insightful. Thanks, Doc. When is the right time to medicate a child for fever? Let's put it like that.
Now, this is a great question to ask, because, often what happens is that when children fall sick, and it's but natural, you're anxious, you want your baby to be well, they become very dull, and there's a lot of panic associated with the fact that the child has spiked a temperature. But there are two things I want to mention here. One, if you prematurely treat a fever, you don't know what you're treating. It takes anywhere between 36 to even about 48, 50 hours for a pediatrician or a clinician to have a fair idea of what is the infection that they're treating. is it a viral, is it a bacterial, is it evolving into something else, is not something that anybody can guess on day one. So it's more important for you to get a correct diagnosis and have a targeted approach to treatment than to blanket start treating on day one, and then if the fever doesn't respond on day 3, day 4, you're stuck because you don't know what you're dealing with. The second thing that I want to mention here is that it's very important for parents to know that fever per se is not a bad thing. Fever just means that your child's immunity is working. So when your child's body encounters a germ or an infection, the first immune response is fever. And children usually spike high temperatures. That's the body's way of fighting infection, and that's their body telling you that our immunity is working just fine. So if your child has a fever, don't panic, don't get scared. Treat it symptomatically. Allow a day and a half, 2 days for the symptoms to evolve so that you know what you're treating, so that you're not giving unnecessary medicines, and keep in touch with your pediatrician.
Okay, that's a good thought. That makes sense. All right, so let's not stress out and get fever phobia like all parents do, and let's handle the situation calmly. So, Doc, a lot of people, feel like that breastfeeding hurts, or that it's painful, it's uncomfortable. I'm sure that there's a lot of people that love it and, feel that connection and that bond with their child. But there's a lot of people that don't love it and get really anxious or irritated when they breastfeed. So what would your advice be to them? Continue to breastfeed or swap to formula?
So breastfeeding is supposed to be a painless experience. The reason breastfeeding hurts in most situations is because the latch technique is wrong, which means that if a child is feeding on the nipple, that is excruciatingly painful, and that is why it hurts. A child is supposed to be feeding on the areola, which is the brown area around the nipple. So if this is a representation of the breast and this is the nipple, the brown area around it is the areola. So when your child latches, the latch should be in this manner. And more often than not, if the child is just latching on the nipple, the feeding is extremely painful. So if you are having painful breastfeeding, please talk to your lactation expert or your pediatrician, because you need to work on your latch.
Okay, Doc, this is a question that actually bothers me a lot. Weight gain in babies. Like a lot of moms have looked at my babies on Instagram they happen to be more chubby than, and also, I'm going to say this, and I'm pretty sure I'm right, that a formula-fed baby tends to put on more weight than a breastfed baby. So I'm not saying move from breastfeeding to formula. I'm saying just don't compare. As long as your doctor thinks that the weight gain is fine, then I don't think that there's anything you need to stress about. But let doctor answer this question anyway. And so the question is, how do you know if your baby is healthy and not underweight or overweight?
I really like this question because mostly the questions that you get from patients is, why is my baby not gaining enough weight? And rarely do people realize that excess weight gain is also not a good thing. So the question should be that, is my baby gaining appropriate weight? Because you don't want a baby to be underweight, but you don't want a baby to be overweight either. And the simplest, most effective way of knowing this is to have your baby's growth, that is weight and height, plotted on a growth chart by your pediatrician. Often because you have the growth chart attached to the vaccine, parents tend to do it themselves, which is fine. But there is a correct technique and a correct interpretation to it, and it must be done in a standardized, uniform manner. So your pediatrician should be doing it. The scale on which you're checking the weight every time should be uniform as well. So the best place to do it is your pediatrician's clinic. If your child is growing appropriately as per their growth potential on the growth chart, that is a healthy baby. Comparing weights of different babies of the same age, very bad idea, because all children are different, everyone's genetics are different, so everybody grows at a different rate and a different potential. So I'll repeat myself here. If your child is growing normally on their growth chart as per your baby's own growth potential, that is a baby that's growing in a healthy way.
Okay, fantastic. So, Doc, there's a lot of people that actually, they don't produce enough milk, but they spend hours and hours and hours with their baby latched onto their, to their breast, trying to get the baby to drink milk, but the baby still remains hungry and is crying. What are the signs that tell you that a baby is hungry in general? How can you tell that your child is hungry?
Now, often when the baby is born, we assume that we would just know everything, but parenting doesn't come with a manual, and while your baby's learning, you're learning too. So the first thing I'd like to tell all parents is be patient. Give yourself some leeway. Don't be hard on yourself. It takes time to pick up the differentiation between the multiple cries that your baby has. So one very simple rule of knowing if your baby is hungry or not is to remember that a hungry baby will cry till that baby gets milk. So if your baby is crying and you pick up the baby and the baby is pacified, that's not hunger. If your baby is crying and you change the diaper and the baby is pacified, that's not hunger. Often parents come and say, well, the baby was sucking on their hand or, was thrusting the tongue or opening the mouth. So I fed the baby, but that's not hunger either. As a rule, a hungry baby will cry and a hungry baby will only be pacified once the baby is fed.
Okay, awesome. Awesome. Now let's get to the poop. How many times is it normal for a newborn to poop? Like, it's so overwhelming when you see this baby pooping. Sometimes it's like, a weirdish color and there's so much stuff happening. And as a first-time mom, you're so confused with the amount of diapers you're changing. So on an average, what do you think, how many times does a newborn poop, and how does it progress over the first year of life?
This is a question that comes all the time because poop pattern, poop color, poop texture keeps changing with age, etc. So for a baby between birth to 1 year of age, anything between 8 to 10 poops a day and gradually going up to 2 to 3 poops a day versus pooping in about 4 to 5 days, 6 days is all normal. As the child grows older, you will find a more regular poop pattern. But having said that, there are 10-month-olds and 11-month-olds who don't poop every day. That is not necessarily constipation. So the myth I want to bust here is that not all children who don't poop every day are constipated. And let me also add here, how do you know if your child is constipated or not? It is to see that if the child is, say a child is passing stools after 2-3 days or 4 days, are the stools hard and is the child straining a lot? If the child is passing normal stools after 3 days, 4 days, that's just their regular poop pattern.
I am so happy that you could come on here and share all these extremely important questions with everyone. So thank you very much for joining us. And guys, we're going to link Dr. Saloni's details down below. So anyone who wants to get in touch with her, especially if you're Bombay based and you want to kind of seek an appointment with her, feel free to connect with her at any point. And don't forget to subscribe to our channel. Please comment down below and ask us a bunch of questions because we assure you we will come back to answer all of them. Don't forget to click that bell icon and see you next time, guys. Lots of love.